So you bring up an important aspect in treatment of osteoporosis in the Asian community. And lactose intolerance patients, they avoid dairy. So dairy is one of the biggest source for calcium. Not only calcium, but also it provides protein, it provides some potassium with it, so that overall helps with the bone health. Now, lactose intolerance is very prevalent in the Asian community. And I go back to the point I made when I was describing osteoporosis. So when the childhood is the most important part of your bone health, that's where you're accumulating more bone as you grow. By puberty, you've accumulated most of the bone, and by 30 years, you have attained the peak bone mass. Now, that's where the calcium intake, the vitamin D intake, and these micronutrients play an important role early on. So when patients who are lactose intolerant, they avoid the dairy, they are losing an important part, calcium, that is required for bone health. Now the substitutes, so there are substitutes besides the dairy that patients with lactose intolerance can allude to, that include green leafy vegetables such as kale, spinach, turnip greens. So they have a lot of calcium in it. You can use soy milk that has enough calcium, and there is some soy milk formulation that have fortified vitamin D in it. Almond milk is another substitute. Other things include tofu that has a lot of high protein besides the calcium. So that's another low-calorie, protein-rich substitute. Other things include nuts such as almonds, cashews. Oat milk is another option which patients with lactose intolerance can try. There are seeds, chia seeds, poppy seeds. So such as if you were having a salad, you get green leafy vegetables, you can put in some seeds, you can put in some nuts. So that can give you a good amount of calcium that's needed, which you cannot get it from dairy. Now, one thing I would definitely point out is that the serving amount should be more as compared to if you're taking one serving of a yogurt, and if you're a lactose intolerant patient, you might need 2 or 3 servings of the foods, the substitutes I recommended, to compensate for that calcium. We always look at first of all, how's the degree of osteoporosis is. Is it severe? Is it mild? Is it the start of the osteoporosis? There are risk factors of fractures. So the first line treatment is oral treatment. And oral treatment is covered by insurance. There is no problem with that. Now, a little bit about the side effects. The oral treatments do have a side effect of irritation of the esophagus, or esophagitis, or stomach gastritis, inflammation of the gastric lining. Now, patients who already have that medical problem, these medications are contraindicated in those patients. So we move on to either intravenous, which is the infusion medication. Now, as infusion medication is given in the setting of an infusion center, and infusion costs are involved. So it's an expensive medication. And when we go to the injection forms, so injections are expensive medication. So in insurance, we have to, first of all, find that right candidate and explain that this is the patient that needs, but there still is a decent amount of copay in certain patients. So exercises is the third part of this treatment plan I discussed with a patient who's newly diagnosed with osteoporosis. Now, exercises is broadly speaking, you have to take into consideration the patient itself. a patient who is 50 years of age will have a different exercise recommendations versus an 80-year-old. So you have to titrate those exercise regimens based upon the patient's age, the patient's functional status, and the exercises which I focus basically on, they include weight-bearing exercises. So that includes walking, dancing, stair climbing. So these are that promote the bones and stimulate the bone formation. Now, exercises such as swimming is actually your weight is less in the water, so they are not that beneficial in the world of osteoporosis. They might be helpful in osteoarthritis, so that's something I also discuss with patients. And then the other part of this exercise treatment regimen I recommend is strength exercises. So strength exercises include weight, using light weights based upon how, again, older patients, I recommend lesser weights. Younger patients, they can have more vigorous training with the weights. You can use resistant bands. So these things improve posture. They improve muscle strength. So, and also some patients who have chronic pain, these exercises also improve your pain. They reduce pain as well. And also the combination of this improves your what we call gait, how your walking is, and reduction in the falls as well. My resource where I refer patients to it's National Osteoporosis Foundation, also known as Bone Health and Osteoporosis Foundation. So they have different categories under on their website, including nutrition section, exercises recommendation. The other recommendation for more worldwide osteoporosis incidence, risk factors, what are the different risk factors based upon race. I refer patients to International Society of Osteoporosis guidelines. I think I have to get back to that, ISCD. I think I just wanted to elaborate the osteoporosis, the silenceness of this disease, and the importance of asking your medical doctors for appropriate screening of this test. And if it is determined you have osteoporosis, and have discussion regarding various treatment options. And I cannot elaborate that this is enough, that this is a major health crisis, because the risk of osteoporosis fractures is on the rise. The patients are aging, we have aging population, and there is a very high risk of osteoporosis. And if we look at the worldwide prevalence of osteoporosis, 1 in 3 female has osteoporosis fracture. So, and 1 in 5 males have osteoporosis fracture after age of 50. So it is very, very important for us to detect this disease early so we can treat early. It's treatable disease, and it is preventable disease in terms of preventing those fractures. And the risk of fractures, not only the fracture, but also the associated, the medical complications, the higher medical costs of staying in the hospital, those rehab, and later that decrease in the functional capacity of the patient is immense. So we can prevent that. But it is something that needs a lot of awareness, just because of it is a silent disease.